Welcome to Day of Discovery. I'm Dr. Pat Tucker. I'm a medical doctor with over 30 years of experience, and I have a great opportunity to work with you folks at AOScan, and so far I'm loving it. So let's go back to what is AOScan. Well, AOScan is a very complex and complicated machine. It's based on quantum physics. It uses frequencies to check different parameters in your body. I don't understand quantum physics, and I don't understand the AOScan. That doesn't mean I don't use it, and that doesn't mean it's not valuable. This is my cell phone. My cell phone is a very complex instrument. It uses airwaves to send voice, text, or data halfway around the world in seconds. I don't really understand it and don't understand how it works, but I know if I dial a 10-digit number in here, I'll only get the person that 10-digit number belongs to. It's very precise, it works, and I trust it. Every day, we use our cell phones without fully understanding how they work, and we trust them. We can also trust the AOScan. Every day, it does what it was designed to do. Even though we don't fully understand it, we can trust it. We use our cell phones, we use our AOScans. That's the way it's meant to be. Let's talk about context. When I pick up my cell phone, I use it the way it's meant to be used. I don't click the button and say, "Beam me up, Scotty," and expect to be teleported somewhere. That's not the context in which a cell phone is designed to work or meant to be used. And it's the same with the AOScan. The AOScan has a context in which it was meant to be used. We can't make it into a teleportation device, just like we can't make this cell phone into a teleportation device. So let's talk about optimization with the AOScan. We've had lots of questions from people about whether optimization really works. Is it a treatment? What does it really do? Well, when we optimize with the AOScan, are we making a change in the parameters or items that are being scanned? The answer is yes. We are making a change. Does that change completely normalize those items that we are optimizing? And the answer is sometimes. And it depends on why the parameter is abnormal to start with and how abnormal it is. If you have pretty severe heart disease and you need a coronary bypass, optimization is not going to fix that. If you have gallstones that are causing you lots of problems, is optimization going to fix that? Probably not. There are ways to get rid of those gallstones using some types of alternative medicine. Will the optimization help? Probably. But we have to understand the context of what and why we're optimizing. I could do a huge panel of blood work on you and find lots of information. Some information I might not even know what it means. But I could explain that information and those results to you and help you understand whether those are serious, whether they're concerning, what they mean, what it means for your health, what you need to do about it, all of those things. What if I ran a huge panel of blood tests on you and just printed out and handed you the results? You're on your own. If you don't understand it, if you haven't been trained in it, it's very difficult for you to look at that blood work and know what it means. Does this little red mark or an H out beside a parameter that means it's high, is that something that's going to kill me or something I don't need to worry about? What does it mean? Do I have an infection? Do I have cancer? I don't know. What we're trying to do here is put the use of the AO scan in context for you. So let's talk a little bit more about the vital scan. Many of the aspects of the vital scan will show you more chronic issues, like lipids, your cardiac parameters, your vascular parameters, things looking at diabetes and prediabetes, those type things. When we look at those, a one-off result just after one time doesn't mean much. But when you start seeing patterns, multiple scans with your lipid panel, your cholesterol, your triglycerides, your HDL, your LDL being out, elevated, then you have to take that seriously. Is there a possibility that optimization will help normalize that? Sure there is. A lot of it depends on how bad it's out. So when we look at that, we have to start thinking, what are we going to do about this? And isn't that really the key? We don't want to receive information and do nothing about it. You know, when the weather alert goes off on your phone and you hear that there's a tornado coming, I mean, wouldn't it be prudent to go down in your basement or go protect yourself if the tornado is coming straight for your home? I think it would be. When we receive that kind of information, we need to do something about it. We're going to help you understand and put in context what we need to do about those things. And we're not talking about medicine. I'm not talking about statin drugs to correct your lipid problems. We do know that you have lipid problems if it's showing up persistently on your scanner. It's very sensitive, sometimes too sensitive, and that's why we see some of the erratic results that we see. But we don't want to jump straight to a statin if you can help it. There are other things that we can do that might normalize that, and then with the AO scan, we can continue to follow those results. So what about diet? Why don't we start eating green things, colorful things? Those are the phytonutrients. If we start eating those and stay away from large portions of meat and a lot of starches, and certainly stay away from the processed or fast foods, we're going to be a lot healthier. That in itself may normalize those lipid findings. And you can watch it every day as you progress towards wellness on your AO scanner. You can also lose weight. And losing weight dramatically helps with your lipids, with your cardiovascular health, with hypertension, with those predispositions to diabetes or full-blown diabetes. It helps all of those things. Exercise. Don't we all need to get in better shape? Don't we all need to start physically exercising and spending time helping our body? Many times when you go to medical doctors, allopathic doctors, the first thing you get is a prescription. I can say that. I am one. Is that the first thing we really need to do? You have in your hands the capability of monitoring your health. You can make changes without taking pills and get back to normal. Return to health. That's what the whole goal is. That being said, let's talk about what the AO scan can do for some of your chronic problems. But we need to put that in context. Let's talk about the Cepheid. So let me tell you about a personal experience that I had with the Cepheid, which is just absolutely amazing. I had just gotten my AO scanner, not my wife's, mine. And I had had the flu over Thanksgiving, and when I was a child, I had childhood asthma, and it kind of went away when I was an adult. But when I get sick with a respiratory infection, it seems like the last thing to go is the cough and sometimes wheezing. So, and obviously, like most of you moms know, everything gets worse at night. So I was coming back from a business trip, got home about 12:30 at night, and I was doing great. I hadn't coughed on the plane. I didn't cough on the hour-and-a-half drive home. I was just doing great. I went into my bedroom, stripped down, and was so ready for bed. And right before I got in the bed, I started wheezing. And I don't mean just a little bit. I mean, I was wheezing a lot. And immediately it goes through my mind, oh my gosh, I'm going to cough and wheeze all night. I'm not going to get any sleep. I'm exhausted, and I'm going to keep my wife awake. So it just crossed my mind. Let me look and see if there's something on the Cepheid for wheezing. And I opened it up in my name and started looking, and couldn't find wheezing but found asthma. And I know that my cough typically comes from that bronchial spasms that comes with asthma. So I said, let me try that. So I put it on asthma, and I started it continuous and just ran it all night. Literally, my head hit the pillow, and within, I would say 10 or 15 minutes at the most, I don't remember going to sleep. I don't remember having a hard time going to sleep. But the wheezing went away. I slept like a baby all night and never coughed all night. And I was so shocked. I woke up the next morning and I was so excited, telling my wife. So the coughing didn't stop at that point. So every night when I went to bed, I would cut on my Cepheid for asthma and run it all night. I didn't always sleep perfect, but I didn't really wheeze anymore, and my cough went down to virtually nothing. There's a huge benefit for the AO scan and for Cepheids, but we have to put that in context. And the context is Cepheid means subtle energy frequency imprinter. And like Lauren always says, the key word really is subtle. So let me give you a couple of examples that I think will help you understand what we're talking about. So some of you folks have cats, and some of you folks have those little bitty laser lights that you like to run around on the floor and make your cat chase for entertainment. That's a very low power laser, but it's a laser, and it's a frequency. And that laser is not going to hurt your cat if it runs over their skin or runs over your skin. It can hurt you if it shines directly in your eye, but that's it. So the difference is the lasers that doctors use, they can cut and burn your skin with lasers. We need to understand that the Cepheid has a different powered frequency. It's not down to the level of not doing anything, but it's certainly not to the level of being able to harm you. We can't give you a device that if you make the wrong choices, that it's going to harm you. The frequencies that you get in the Cepheid will help. It's been proven. It will help. It helped me dramatically. For over a month, I used the Cepheid for asthma every night, and it made a dramatic difference in how I slept and my wheezing and my cough, and I've proven it to myself. So let's go back to the gallbladder example that we had earlier. The Cepheid quantum frequencies have frequencies for gallbladder and gallstones. And those frequencies will help your gallbladder and your gallstones. But it's not to the power that is going to go in there and break up your gallstones in a matter of days. And depending on your gallstones, versus somebody else's gallstones, it may take months or even years of using that Cephi. Now, it may clear it up in a month. I don't know. And that all depends on you and your body. Those frequencies cause your body to realign and help your body to start breaking down those gallstones. But it's not an immediate thing. So I can't tell you whether you need your gallbladder out or not. I know your gallstones are probably just the right size to cause serious problems. So that's going to be up to you. I can tell you that in the context of Cephis, we don't expect them to make massive changes quickly. Because if we gave you that kind of power, it would probably hurt your body some way or another. So let me give you another little example of that context. If I was in my clinic and I had a 250-pound man that came in with a pretty good-sized pneumonia and pretty sick, I might put him on a pretty powerful dose of antibiotics. I wouldn't give 40 the same dose as I would give a 250-pound man. But that 250-pound man is going to respond to the higher dose quickly. Could I triple or quadruple that dose? Sure I could, and it may kill off the bacteria in his system a lot more quickly, but it would also hurt him. We know the upper levels of antibiotics that we can give without actually hurting people. So at least serious hurts, because all antibiotics have side effects. But if I gave him the dosage of that child, it's really not going to do anything. So what we're trying to do with that Cephi is give you enough to accomplish what we need and what your body needs to heal itself without actually going to the point where we're giving you so much that it hurts you. So that being said, there are things that we can do for your gallstones. There are things that the scanner can do for almost every chronic problem. But some chronic problems have developed to a point where subtle energy frequency imprinter frequencies aren't going to be powerful enough to be able to fix you and put your body in a place to fix itself. So let's talk about how we go about monitoring our health. So when you're looking at the scanner and you see that your lipids are high, or you see you have some abnormalities on your insulin levels, some of those things. When you start making changes, make sure you document that. Journal. Write down what your patterns were and what your scanner was showing before you start, eating a lot of greens, a lot of those colorful foods, the phytonutrients that are so healthy for you. Meat is fine, just not large portions of meat. And then stay away from processed foods. By far, the processed foods, the fast foods, are absolutely the worst for you. If you're able to start working out some, even if it's walking, losing weight, changing your diet, those are things that you need to journal. Say what you're doing. Monitor the results on your scanner. The scanner is going to show you week by week that you are making real and valuable changes in your body and in your life. Let's talk a little bit about some of the other sections of the vitals, which are a bit more confusing, not only to you, but to us. Let's talk about the area that looks at fungi, that looks at viruses, that looks at bacteria. Those are quite confusing to all of us. I had said a couple of weeks ago that when you are looking at those things, the scanner doesn't know whether you're ill with that virus or that bacteria or that parasite that's showing up, or whether it's just showing up. One of the analogies I use is eating a salad. I can almost guarantee you that almost all lettuce that you eat in a salad has not been washed enough. And even if it is, you will still have parasites and bacteria on it. That's a fact of life. They're everywhere. They're on our skin. We can't wash them off. We are constantly inundated with bacteria. You have bacteria from your lips all the way through your GI tract. Technically, it's outside of your body. I know that sounds strange, but it is. Your colon has billions and billions and billions of bacteria. Most of those are good, but it depends on your diet. And a population of bad bacteria in your gut, you will be much more unhealthy. But fixing that, getting the good bacteria in your gut, and there are many ways that we can talk about doing that, will make you much more healthy. Those bacteria are not just a placeholder to keep the bad bacteria or parasites that we eat on that salad from finding a place to settle and make you sick, but they also do good things for you. They're a placeholder, and they create many different chemicals that help your body. And all of these things, when we eat poorly, we are causing our gut to be more unhealthy. When we eat good, we are causing our gut to be more healthy. The healthier your gut is, the more likely you are to be able to lose weight, the more energy you're going to have to work out, and the better you're going to feel. And there is no doubt about that. But those bacteria, like I said, they're quite confusing. Let's talk about how many bacteria there are in the world. There are lots, not in total numbers, but even genus and species of bacteria that we have identified before, there are thousands. Well, on your scanner, you're not having to scroll through thousands of different bacteria. Why is that? Well, possibly because we don't have the frequencies for all those bacteria. But more likely because you wouldn't look at it anyway. I mean, that's a lot of information to go through, especially when you don't have a context for what it means. So in that, let's look at this. Those bacteria that show up are not making you sick most of the time. Now, sometimes you will have the bacteria or the virus or the parasite present on your scan at a 9, which is making you sick. But you will always see a lot of bacteria, a lot of viruses, and a lot of fungi on your scan. That is because the immune system that God made is working. God made your immune system to block viruses, bacteria, and fungi and keep them from making you sick. The immune system is very complex. And thank God I don't have to know exactly how it works, but God knows. He created it to work well and to keep you healthy even when you get exposed to those bad bugs. And aren't we thankful for that, because we would be sick all the time. I have 2 urgent care clinics, and when I hire new staff that aren't used to being, and it's typically the front desk people who aren't typically medical, but they come to work and they might have had another job that has nothing to do with medicine before. And unfortunately, those people are getting exposed to so many things that they don't have immunity to in the first few months. They stay sick all the time. But their immune system eventually catches up and creates an immunity for them, so when they do get exposed, they're not automatically getting sick. The scanner is very difficult to read when we're looking at these different parasites. You have to understand The scanner is finding frequencies of bacteria, viruses, and fungi that we don't have an exact match for. I mean, that 100 or less bacteria that are on the list of your scanner, when your scanner identifies a frequency that it doesn't have an exact match to, it puts that frequency into whichever bacteria or virus or fungus that is as close as it can find. Sometimes you will see bacteria like Neisseria meningitidis. Now that's a big word. What does it mean? That's the bacteria that causes meningitis. I mean, not the kind that puts you in the hospital for a few days, the kind that kills you within a few days. So when my scanner shows up, Neisseria meningitidis, does that mean I have meningitis? No. Does that mean that I have been exposed to that bacteria? Well, that's possible. That's possible that you've been exposed to that, but it also may be that there are other bacteria that your scanner is picking up the frequency and it just gets dumped into the Neisseria meningitidis folder because it's as close as it can come to saying you've been exposed to this. It's very difficult. We're trying to figure out a way to better utilize those sections to be functional. Right now, and this is one of the idiosyncrasies of the AO scan, it's not tremendously functional because the scanner is picking up all these different bacteria, viruses, and fungi that aren't making you sick. So it's not diagnostic, and that's why it can't be diagnostic. It's a guide. It's an educational tool, which is fabulous. But it's not perfect. But as time goes on, it will become more perfect. And week by week and month by month, we are finding more information and making more connections. Maybe one day you'll have to scroll through 1,000 bacteria frequencies from your scanner. I don't think that's going to happen, but it may. It just depends on the needs. We want it to be as functional as possible. It's a fabulous tool, especially for chronic disorders when you're looking at vitamin levels and micro and macro minerals, all those things. It's a wonderful tool to look at. And that guide, those persistent findings help you make changes in your life that will affect your health without going to the doctor to get blood panels every week, without taking a handful of pills every day, or like some of my patients used to walk in the door with a Walmart bag half full of medication bottles. Not that I prescribe, by the way. The whole goal is to try to become healthy with every modality available and the best of the best. So if naturopathic medicine is the best way to go for something, that's what we should do. If chiropractic is the best way to go for something, that's what we should do. And if you go in the ER with acute gallstone attack, don't pick up your scanner. Not going to do much at that point. Hopefully this scanner can keep you healthy and keep you from getting to the point where you need to go to the ER with a gallstone attack or a heart attack or any other result of a chronic illness. We're trying to keep you healthy, and this device is going to help us dramatically. There's going to be a whole panel of doctors of every sort, naturopathic. We've even got a veterinary medicine physician who's joining the staff. and you're going to love some of the stuff he's got to tell you. And obviously Deborah Bruce, who is a genius on energy medicine, we're very excited to have her on the board and to continue to work together and to brainstorm together to help make the AO scan something that's much more useful and beneficial to you as we go down the road together. We have some goals here for you at Solex. Lauren and his team have put together a medical advisory board for the AO scanner. We want to give you the context needed for the information you're receiving from the AO scanner. We know that that information sometimes is overwhelming and doesn't make a lot of sense. So we need to give you the information you need for that context. With that context, the information you receive will make sense. With training, we will help you understand how to help yourself and others resolve their abnormal findings, become healthier, and monitor those items going forward. This is not like lab work. When you go to the doctor's office and you get blood work drawn, that can change from week to week. This information that you get from the AO scanner is going to give you information from day to day. Most of us can't afford to go to the doctor and get a whole $1,000 panel of blood work done every week, but with the AO scan, you get that, and it doesn't cost any more. Solex didn't create quantum physics. God did. Einstein, Tesla, and many other brilliant scientists began to understand and describe quantum physics, and Solex invented the AO scanner to use quantum physics and frequencies to help monitor living beings. I say living beings because we're now discovering that the scanner works on animals as well as humans. There is much we still don't know about the capabilities of the AO scanner. It's still way farther ahead of our ability to understand what it's gathering. Even months and months ago, we were picking up 2,000 frequencies in inner voice when we only realized that they were 70. Virtually every week, we're discovering new frequencies and making more connections to create more context for the information we're receiving. We know the AO scanner works. We have years of proof and the testimonies that go with it to help prove that. I have multiple testimonies from my own use of the AO scanner. It's an amazing tool. Soon we will be offering more training in Phase 2. The context you receive from that training should catapult you into the next phase of your knowledge, understanding, and benefits from our scanner. Thanks for the opportunity to participate in this great adventure with you. I look forward to learning and growing with you.